Cochrane is all about making good healthcare decisions. Researchers all over the world can compare and compile studies that then become available for everyone through the Cochrane Library for healthcare professionals, patients, and policymakers. Cochrane produces high-quality literature reviews using systematic methods, which are called systematic reviews.
Cochrane is an international network of researchers that perform systematic reviews of the evidence. And the overall objective is to ensure that the treatment we use every day in the clinics are based on the best possible knowledge, which is independently assessed and quality checked.
Cochrane is a not-for-profit organization and only collaborates with organizations that are free from commercial interests. This way, Cochrane wants to counterbalance the research made by the healthcare industry.
Most of the evidence we have is generated by pharmaceutical companies, if we're talking about pharmaceutical treatment, or by device manufacturers, if we're talking about medical devices. And of course, there is a conflict of interest because you're basically testing the product that you are later going to hopefully sell and make a considerable profit on. So it's important to have a set of eyes to look at that evidence from the outside and quality assess it and summarize it, because otherwise it can be used scrupulously for marketing purposes.
Cochrane was founded in 1993. Today, there are over 50,000 people from more than 130 countries collaborating. 2017, Cochrane Sweden was launched and an office opened in Lund. Already, there are more than 1,300 Cochrane accounts in Sweden. Cochrane systematic reviews are part of the Cochrane Library. The Cochrane Library is a collection of databases that contain different types of high-quality, independent evidence, such as systematic reviews and other information, to inform healthcare decision-making.
I'm convinced that a close collaboration between Cochrane, both as a national but international as well organization, and this in Sweden might impact also in the healthcare.
Cochrane Sweden is funded by Lund University and Region Skåne. Ingemar Pettersson is both a professor at Lund University and head of research at Skåne University Hospital.
To me, Cochrane International is a fascinating mix of enthusiasm, engagement, involvement, but also structure. And as I knew about it since before, and as I've been working with evidence-based medicine for many, many years, and also being a clinical researcher, I thought this is an opportunity we can't miss.
Cochrane Sweden organizes workshops and other events all over the country. So far in 13 cities.
In Sweden, after the launch in 2017, we had many workshops and also some courses, and open to everyone. So we had medical students, we had the nurses, we had the professors, we had the researchers.
I will use a lot of the tools here from the workshop in my own research this semester, writing my systematic review.
Maria works at Lund University as liaison librarian, a contact between the medical students and the library.
I'm connected to Cochrane in my work as a liaison librarian. Recently, the medical degree program introduced a new theme called scientific scholarship, and many of the activities that Cochrane do are connected to this theme. And we're using an e-learning module called Cochrane Interactive Learning, where the students are going through the process of systematic reviews, which is the basis for evidence-based medicine.
Lund is the first university in the world to include Cochrane Interactive Learning in the education program for medical students. Martin Garvich is professor in neurophysiology and also a representative of the medical degree program.
The basic benefit is clearly, with Cochrane Interactive Learning, is clearly that they can learn to think about assessing the literature in a systematic way, which is something that they do not necessarily master. And so that's from a conceptual point of view. From a practical point of view, it's extremely useful because it's electronic, it's individual, it's divided into modules.
Cochrane International Mobility Program is an exchange program. It's a way for students to learn and use Cochrane methodology in another country.
When I first heard about the Cochrane International Mobility Program, I immediately thought it would be a great chance for me to understand how to conduct a systematic review and meta-analysis, but above all, to do it in another country.
Cochrane is present in all Nordic countries, and the collaboration within the region is extensive. For instance, when arranging workshops.
In Norway, most medical students are trained according to a sort of problem-based learning approach. We don't anymore have this very sort of didactic teaching method in most medical faculties. So they're taught from a very young age, as it were, to assess the evidence, to think about the evidence, and to use it in decision-making. And Cochrane is perfect for that.
With a history of just over 25 years, Cochrane has already had an impact worldwide. 80% of WHO guidelines use Cochrane reviews, and the Cochrane database of systematic reviews is the most referenced health journal on Wikipedia, followed by the New England Journal of Medicine and the Lancet. There are a number of examples of how Cochrane has both improved healthcare and saved money.
Italian-Canadian collaboration on a Cochrane review that evaluated two medications to treat a common eye disease found that the much cheaper alternative was similar in terms of safety and efficacy. And calculations have shown that, for instance, for large healthcare systems such as the Brazilian healthcare system, that could save up to $5 billion over a period of 4 years. So these are reviews that probably have very, very big impact on healthcare policy and on healthcare financing.
I think the influence and the impact that Cochrane can have on the research at Lund University is the way it can influence research globally, to make sure that before we set out on new projects, we find out in a systematic way what is already known and what is not known.
As a student, to get involved in Cochrane would provide you with a community and the tools to continue the journey towards finding evidence and supporting both your clinical work to find the best possible treatments, but also to expand your knowledge base as a researcher, and especially for the future.